My name is Debo. I'm a medical doctor and a management consultant in healthcare. I'm also the founder and CEO at Doctoora Health Limited. At Doctoora, we provide fully serviced medical facilities for health professionals and their patients. And by so doing, I've created a marketplace that enables health professionals in Nigeria to start private practice without incurring setup costs. What our platform enables is that professionals who would have otherwise emigrated in search of better fortunes, as they say, now can find a thriving practice and run that in Nigeria and increase access to care for different people who might be needing healthcare. Greenhouse Labs, I think, was generally very interesting, to be honest. I think everything was really quite detailed. I think it was also great that the people that were hosting the sessions were not just people that had written books or done theory. They were living the talk, actually. So learning from those people was really great. I think the session I liked the most was with Fola Olatunji David. He was currently at Google at the time when he came in, and he spoke to us about quite a lot of things in depth. And I feel that that session really connected to me. The other session that I would have said out of the Greenhouse Lab thing that was really great was, things around the finance. Obviously, as an entrepreneur, we know we have to focus on unit economics, but going over those things over again and looking at other ways to remodel the business, to rethink your pricing. They were very engaging sessions, and I think generally it was a great end-to-end. I wouldn't say I want to pick a session over the other, but that session with Fola stood quite out. I would say the most important thing about our current position as a business now is that we are actually really close to funding. Beyond even being very close to funding, we've been able to test out more revenue models. Very interesting revenue models that before would have been really difficult to try out. And I kind of slightly hint towards the fact that COVID has also brought our company to the limelight, being that there are not many companies in Nigeria or West Africa with the capabilities to do what we do. First, being able to provide facilities for general practice. And if we look at it from the perspective of patients, people don't want to go into a hospital now, so they're first thinking about, is the place clean, is it sanitized? And our setup has been small clinics, locations that we can really clean up easily, and that gives extra confidence to the patients. So that has really contributed to our business. A lot of doctors as well became idle when the COVID thing started because private practices shut down, so that also led to a lot more sign-ups for us. I would say people are also very conscious about their care now, and they are no longer pricing or haggling medical services, so that's great. That has also contributed significantly to revenue. And like I said earlier, we've discovered a few new things. COVID has opened our eyes to what we did normally as home care now is something we can really accentuate and do with COVID home management, for example. And I think we're by far one of the pioneers in the home management and remote surveillance of COVID cases in Nigeria. And that is significant at this point in time, where people are actually willing to, get quality services. Lastly, telemedicine. Telemedicine used to be something that was used primarily to reduce costs with our private practices. So the typical thing is that a doctor who is based in Ikeja had to see a patient in Lekki. He would have gone for a physical consult for the outpatient, requested some investigations. The patient would do these tests. It makes no sense for the doctor to go all the way to Lekki again just to explain the results of the tests, right? So telemedicine in the past used to be our route to resolve that. So the doctor would actually give a phone call or a video call to the patient, they discuss the results, they update medication or treatment, and they move on. Right now, telemedicine actually is like the first point of call. So most people want to speak to the doctor first to know whether they need to go to the hospital. So we've played around with the models for telemedicine. Obviously, the pricing would be different. The way the doctors also would be selling their services are different. So I would say we've done a lot in terms of learning, understanding the market, being able to segment services since the lab. When we ended the lab, we had planned that we wanted to start a maternal care service that is up and running. We've also set up our own GP practice and mental health practice called Calm Springs Health. And all that ties into increasing our revenue as well as increasing the brand. We're also doing a few more things on the marketing end to help people kind of achieve healthier lives. And that has to do with meal planning, recipes, getting them, something that isn't direct, come and talk to a doctor, but gets to keep people healthy and a bit sticky to our platform. So the highlight really must be that yes, we are close to funding. The funding discussions with the potential investors have gone to the point where I think we should be able to seal deal anytime soon, and that is quite interesting for us, knowing that with the traction that we've gained since COVID, extra fuel to that engine would significantly help us move and gain extra momentum. Greenhouse Lab, I think personally it felt like I did that program twice. First because I was in a boot camp for the Nigerian Economic Summit Group startup contest, which was managed by Greenhouse Lab. I think about a month before the labs itself started. So I got a real dose of what I would term as really good professionalism, good delivery, mastery of concepts, and a strong network. So I would say to advise future Greenhouse Lab participants, the best advice for you guys is to really capitalize on the time while you're here and ask as much as possible. Be that person that after Greenhouse Lab is done, Mary or Ruby would talk about that, this person really asked so much of us. Yes, and they're going to go all the way and support you in as much way as possible. So I think the most important thing is just to ask, accept that while you're in the labs, there's nothing that is stupid, or no one's going to look down on you for not knowing those things, and it's an opportunity to learn. And even if you've learned those things before, come on, I think Greenhouse Labs would have probably been the third accelerator I've been at, and it was real. And I could compare that to the different accelerators or even incubation programs that I've been in, and trust me, it was worth it.